The ill-fated Ruby Princess has docked at its new temporary home south of Sydney. The ship now the focus of a criminal investigation. More on that shortly. As we look at the latest numbers in the fight against coronavirus, overnight a further 2 deaths were recorded in New South Wales. 18 lives have now been lost across the state. The number of new cases dropped to 57, but we're being reminded that less testing takes place over the weekend. Let's go live to Chief Reporter Chris Reason. Good afternoon, Chris. The Ruby Princess is currently in Port Kembla, but what's the plan from here?
Good afternoon to you. And yeah, she docked this morning with 10,040 crew on board from 50 different countries. The plan now, no one getting off, but people are getting on, Australian Border Force officials and New South Wales health officials as well, to try and get an accurate picture of how many of that crew could potentially be infected with coronavirus. And what they plan to do is separate those that are not and give them 10 days in isolation before they are allowed to steadily make their way off the ship, and then they plan to repatriate them back to their homelands. They come from 50 different countries, and the government at this stage is talking about charter flights to get some of them home. Now, there was a lot of angst and anguish this morning in and around Port Kembla. A lot of locals that did not want to see that ship pull into their area, worried that the coronavirus might leach off the ship in some way, or indeed if passengers have to be taken off the ship and put into their hospitals, that it would overwhelm the local hospital system. Now, the Police Commissioner Mick Fuller is saying and standing by the fact that that will not happen. It's happened, saying that he guarantees the town's safety and says that people won't overwhelm the hospitals because he'll spread any potential crewmen across the region. A lot of questions, though, about the health policy on this one. And remember when the ship first pulled in March 19, the policy of New South Wales Health was to get them off and get them off fast. Well, now it looks as though it's completely 180 degrees the other way. It's to keep them on board and not let them go anywhere. And New South Wales was struggling to explain that concept this morning. Here's a small part of the exchange we had with New South Wales Health Officer Dr. Jeremy McNulty. Now it seems that the policy is completely flipped. Keep them on as long as possible. Why the change?
Look, I'll have to defer to the police investigation. So I will defer to the police
but it's your
investigation
advice, so
about that.
We need to know what advice you're giving them.
Yeah. But that will be part of that investigation. So.
Well, one thing it does give the police is an advantage that those passengers, those crewmen will still be on board. Of course, the investigation to begin straight away by the homicide squad, no less. And Mick Fuller saying yesterday that there were potentially thousands of witnesses in this investigation. I hate to be blunt, but sadly we have one bit of bad news to break this afternoon. One less witness, if you like. Another man confirmed, pronounced dead in WA, who was a passenger on board the Ruby Princess this afternoon, an 84-year-old. Anne.
Oh, more sad news there. Chris Reason in Sydney. Thank you, Chris. Wage relief will not be extended to casual workers excluded from the government's new JobKeeper scheme. The federal government today ruling it out while finalising the legislation. Live to Olivia Leeming in Canberra. Olivia, this is despite pressure from Labor and unions.
Yeah, it is, Anne, though. Ultimately, Labor will pass this $130 billion wage subsidy scheme through the Parliament when it will be approved on Wednesday. But it is still concerned that many casual workers and contract workers will miss out. The government has confirmed the JobKeeper payment of $1,500 a fortnight will only be available for workers who've been with the same employer for at least 1 year. The rest will be forced onto the lesser job seeker payment.
There have to be some definitions and some lines drawn. We think this is a fair and reasonable line.
1 million workers have their circumstances up in the air, and there is still time for this to be fixed.
Olivia, there will be more support for charity workers.
Yeah, charity workers, we've learned today, will be able to access that JobKeeper payment if their organisation's revenue has dropped at least 15%, helping some of the 1.3 million Australians who work for a registered charity. But welfare groups want that threshold to be even lower and exclude grants given to charities, as they argue they are often tied to certain funding for certain projects, warning that many charity workers could still miss out. Anne.
Olivia Leeming in Canberra. Thank you, Olivia. There are fresh concerns for the British Prime Minister, who's now in a London hospital 10 days after testing positive for coronavirus. Boris Johnson is still dealing with symptoms, including a temperature, and is having routine tests on the advice of his doctor. Johnson remains in charge of the government, but the Foreign Secretary is expected to chair a meeting about COVID-19 in the morning. Staying in the UK, and the Queen has delivered a rare speech about the pandemic, just the 5th Commonwealth address in her 68-year reign. As Europe Bureau Chief Hugh Whitfield reports, the royal appearance was used to thank frontline health workers and rally the nation.
A rare address from the Queen at Windsor Castle.
I'm speaking to you at what I know is an increasingly challenging time. A time of disruption in the life of our country. A disruption that has brought grief to some, financial difficulties to many, and enormous changes to the daily lives of us all.
Her Majesty acknowledging the hardship and loss inflicted by the virus, praising medical staff and the way Britons have thanked them.
The moments when the United Kingdom has come together to applaud its care and essential workers will be remembered as an expression of our national spirit. And its symbol will be the rainbows drawn by children. I hope in the years to come, everyone will be able to take pride in how they responded to this challenge. And those who come after us will say the Britons of this generation were as strong as any.
Royal broadcasts like this are exceptionally rare. Elizabeth's first was as a princess, alongside her sister Margaret in 1940 during the Second World War.
We as children spoke from here at Windsor to children who had been evacuated from their homes and sent away for their own safety. Today, once again, many will feel a painful sense of separation from their loved ones.
But there was, too, a message of hope.
We will succeed, and that success will belong to every one of us. Better days will return. We will be with our friends again. We will be with our families again. We will meet again.
The Queen at 94, of course, is in a high-risk group for coronavirus. Just one cameraman was in a large room at Windsor Castle where they practiced social distancing while recording that, and that cameraman was wearing full protective gear.
Ireland's Prime Minister has joined the coronavirus fight, announcing he'll work as a doctor 1 day a week. Leo Varadkar has re-registered as a medical practitioner. He was a doctor for 7 years before entering politics. The 41-year-old won't come in contact with patients, instead conducting phone assessments of those who may have the deadly virus. Starting today, our supermarket giants are introducing strict new social distancing measures as they gear up for a very busy Easter period. Peter Fegan has been following the story. Peter, what's been the message from the major chains?
Well, Anne, get in early but be sensible. That's the very clear message from the supermarket chains today, just days out from the Easter break. Shoppers are being warned that despite coronavirus restrictions on what people can and can't do over the holiday break, it still will be a very busy shopping period. But again, today they've reassured the public that there is plenty to go around and there is no reason to panic buy.
7 weeks ago, where we were seeing huge unprecedented demand in key products, that has definitely calmed over the last couple of weeks.
Stores right across the country will implement strict new social distancing measures to ensure people abide by the rules during the busy periods. There will now be a limit on the number of shoppers allowed in store at any one time. Designating waiting areas will be set up outside the stores and staff will count the number of customers coming in and out. Larger stores will have a maximum capacity of just 200 people, smaller stores less than 100. And police will also be on patrol.
So the door greeter actually counts in via an app that we've got on a mobile phone. They count in the customers.
Limits on the number of items you can buy, such as packets of pasta and toilet paper, still apply. So too does community hour for the elderly, and online shopping is available to both the elderly and vulnerable. But again, Anne, to reiterate the message from the supermarket chains today, that is to get in early but to be sensible, and there is plenty to go around.
Australians are again being told don't become complacent despite encouraging coronavirus results overnight. Sadly, another 2 lives have been lost in New South Wales. Live to Miley Hogan in Bondi, one of the virus hotspots. Hello, Miley. What do we know about the latest victims?
Good afternoon, and well, both victims were men and they were in their 80s. They passed away in Liverpool Hospital overnight. One was an 86-year-old man who was a resident at Opal Care in Bankstown. That aged care facility has now been associated with 5 cases, 3 staff members and 2 other residents. Now, the death toll in New South Wales sits at 18. There are now 2,637 cases of coronavirus statewide and 57 new cases diagnosed in the last 24 hours. Health authorities have labelled that figure as hopeful. They say that the social distancing measures, they're hoping that those are working, but they're asking people to stick to it, saying it's too early to make any definite decisions on that. Now, it comes as health authorities released a list of areas that they are calling hotspots.
So these areas are Broken Hill, Lake Macquarie, Manning, Waverley, Wallara, Ryde, Macquarie Park, Dee Why, Manly, Nowra, South Nowra, Byron and Port Macquarie. So as an added precaution, we want to make sure that we have access to testing in those areas where there may be some local transmission.
They have now actually relaxed the testing criteria in those areas. Anyone with a cough, fever, sore throat can walk up to one of those clinics and get tested. Here in Bondi, they've set up a drive-through clinic. It is free, it's easy. You drive up, they swipe your throat and your nose, and then they will contact you to let you know if you are positive. It's all about diagnosing those cases as soon as possible and getting people into isolation. Anne.
All right, Miley, thank you very much. Frontline healthcare workers may soon have another weapon in the fight against COVID-19. Melbourne scientists are developing a test that will identify who is immune and who's most at risk if they contract the deadly illness. Jodie Lee explains.
Researchers here at the Burnett Institute are developing a unique weapon in the fight against coronavirus. Currently, we only have a test to determine who is infected with COVID-19. But this team has found a unique way to determine who is infectious, who is immune, who is likely to suffer serious symptoms, and who could only develop a mild form of the illness.
To test it, we need to examine patients who are convalescent, so who have recovered from the infection. And of course, we now have cases in Australia, but we're trying to get samples from.
In a week or so, these researchers will receive blood samples from infected patients in epicentres across the world: Italy, China and New York. It will take just 2 hours for scientists to break down and understand the patient's immunity.
There are indications that certain types of immunoglobulins or antibodies really drive inflammation, whereas other types dampen it. So that could be a difference.
The test won't prevent people from falling ill, but it could keep vital healthcare workers on the front line. By knowing how susceptible they are to this virus, hospitals will be better able to manage and protect their teams.
Thanks, Jodie. The challenge of keeping the homeless healthy is on the agenda in New South Wales. A program is underway aiming to bring people off the street at a time we're all being told to stay indoors. Healthcare workers say the homeless are vulnerable to complications from the illness.
The worry is that the virus could potentially transmit to a number of people who are experiencing homelessness.
7 News has exclusive details of the initiative tonight at 6. A 21-year-old man has pleaded guilty to coughing in the face of a police officer at Bondi Beach, leading to a coronavirus scare. As Natasha Squarey reports, he's been released by police after testing negative for the virus.
Good afternoon. Well, the 21-year-old spent the night in police cells here at Surrey Hills after he was arrested at Bondi Beach yesterday morning for coughing in the face of a police officer during an arrest, sparking a coronavirus scare. Clayton Eade went against orders to go onto the popular strip of sand around 9 a.m, and he also ignored warnings from lifeguards. Police were called and ordered Eade to leave, but when he refused, he was put under arrest. During the attempt to get him into handcuffs, Eade coughed at police, admitting he said, "I don't have coronavirus."
Let me lean up against this and let go.
The 21-year-old was charged overnight with a string of offences, including resist arrest and intimidation. This afternoon, he faced a magistrate and pleaded guilty to all charges, saying he only went to Bondi Beach because that's where he spread his late mother's ashes. It's also been confirmed he doesn't have the virus.
Why did you cough in that police officer's face?
Because he was not 1.5 metres away.
Eid was sentenced to an 8-month intensive corrections order and an 18-month good behaviour bond. He was also slapped with $300 in fines, and for the next 3 months, he must stay away from Bondi Beach.
Being cooped up inside for too long can be harmful for both your mental and physical health. Dietitians are worried a lack of exercise and emotional or boredom eating could make things even worse, as Tristan Varias reports.
Thousands right across the country are going through one of the toughest times they'll ever face. Job losses, financial and relationship stress. Dietitians are worried that unhealthy food choices and a lack of exercise could make matters worse. In supermarkets across the country, cake, muffin and brownie mixes are emptying off the shelves. Some stuck at home are curing their boredom with baking.
We don't know how long this is going to last for, and we're not wanting to develop bad behaviours over months and months that then become really, really catastrophic to our health in the long term.
On the other hand, plenty of people are out and about working up a sweat more than usual, all the while keeping their social distance.
We are exercising a lot at the moment because it gives us something to do and a chance to get out of the house.
But for seniors like Merv and Marlene Gibson, leaving the house is not advised. So to keep active, they're treating their chores like workouts.
Keeping the pool clean and go for a swim and wash the cars and cut the grass.
To help at-risk groups further, some are calling for TV programs like Aerobic Oz Style to make a comeback.
1, 2 and a clap. Move it to the back and front again.
If you do love to bake and it's not something you can go without, the advice is to swap the cake mix for a healthier, low-calorie recipe, curing your boredom but not at the expense of your waistline.
For those finding it tough just to get out and about, a surprise delivery of the most basic essentials can go a long way. And for some war veterans and widows, a special care package will help make day-to-day life that little bit easier, as Jess Ridley reports.
Well, you would think after weeks of panic buying at the shops that it may have calmed down enough for some of our vulnerable members in the community to get their hands on basic supplies like toilet paper. But sadly, that is not the case. And we're hearing there are still those finding it hard to access those items. New South Wales Counter-Terrorism and Corrections Minister Anthony Roberts has managed to acquire some 8,000 toilet paper rolls, which he and a team have started distributing to war widows and veterans in his local electorate of Lane Cove in Sydney.
I never thought I would see the day in this nation where we had people that have built this country and fought for this country not having access to a basic sanitary product such as toilet paper. This is a time as a community we need all of us to do our very best to look after those that are in a very vulnerable condition.
This clever video has been put together by a women's football club in South Australia. Now, they stress that no toilet paper was wasted in the making. Delivery drivers and couriers are finding letters of thanks like these strapped to post boxes around the country as part of a new Thank a Postie campaign, recognising the men and women that are still out there making sure we get all our mail orders during this time.